wake up 4 o'clock and we're going to take the 2 taxis to the hospital. Maybe we take 2 hours to drive to hospital, and we're waiting for the collecting the cards. We're also waiting another queue to see the doctor.
I had left home this morning at 6:30, reached the hospital at about 8:05. Quite a big, very big queue.
Sifika ngo-4 ekuseni la esibhedlela ndiye ndawo elandayo ngathi nje la kudokotela ndiqale ufika udokotela ufike ngo-10. La silanda khona imithi kangangoba namanje mina ngwatholanga, and futhi yabona sihamba late, yabona namanje nje asulala namanje emakhaya uzanyenza uba masilale esibhedlela.
When they collect the medicine, some of them we can't read it right because the writing was so messy.
You would get mixed up as to how to use that dose, and you sometimes give the wrong dose, which can be actually a risk to the child as well, or the person taking the medication.
If you are asking why I can't get all this medication, they say they're out of stock. You must come for another day. And another day you must come to join the another queue, then going to the chemist again. We are taking for maybe the whole day to collect the one medicine.
By the time I got here, we had maybe 90 patients a day in the ARV rollout. I had a staff complement of 1 counselor, 2 pharmacists and 2 assistants. And since then it has grown to more than 10,000 patients.
When you get to the pharmacy, in the past you would stay there for at least 2.5 hours. They even display on there, they got waiting times. They write there, you can expect to stay at least from 2 hours or over, maybe 3.
Everything done in the pharmacy was manual. So obviously your waiting time was quite high. There were certain days where the patient load was so great that we had to actually turn patients away. We didn't have any kind of label dispensing program. Everything was manually done. So you can imagine having like 400 patients and having 2 pharmacists writing out labels for all of those patients. So it did take us extremely long. We were basically standing on top of each other trying to push patients out. It was extremely stressful. The systems that were brought in were actually too complicated for the data capturers to utilize because they had no medical or pharmaceutical background. There were too many screens, too many options, and they just couldn't cope.
Eakendale was often in the headlines and in the news for all the wrong reasons. There were often headlines of long queues, patients queuing from 4 o'clock in the morning. Chilisoft is originally from Pietermaritzburg, and Eakendale is on our doorstep. We felt that it was our turn to give back to the community, and we were confident that our solution would be able to add immediate benefit to Eakendale. So our approach was very simple, and it works in public hospitals because it doesn't depend on all the processes being aligned in order for your solution, which is at the end of the chain, for it to work. The challenges for us is dealing with your public sector environment. We do not have the luxury of implementing a web-based solution because the infrastructure in public health is very limited. The bandwidth is also very limited.
We chose to use a Windows client-based solution so that it would be fast for the user to use. When the patient comes in, they've already got the screen open where the details can be looked up. They can immediately see their previous prescription, and with Pressing a few buttons, they can dispense that and print out the labels.
When we got the system in, we requested the intern data capturer to capture all of the patients so that when we went live with the system, all that information was already on. Because of the medicine groups that you allowed to input onto the system, it minimizes the risk of dispensing errors, especially when you have data capturers that don't have a medical or pharmaceutical background.
We were also able to provide a lot of the institutions with a pre-populated medicine database which got them up to speed quickly, so that from day one they could start actually dispensing. We'd normally spend maybe half an hour to an hour training the user when we install, and that was all they ever needed. People have come back and said it's really easy to use and they're getting a lot of benefit out of it.
If the patient is already on the system, then the regimen will show up. If the patient is not on the system, then we capture it from scratch, and then the ID number, the name of the patient, the address, the age. Most of the patients, especially those who have been here for quite some time, they are complimenting the new system. They are saying it's faster now.
They don't have to wait as long in the queue because the entire dispensing process is now speeded up. The labels that they receive on the medication is clear and legible, which leaves you more time to counsel the patients, to monitor their adherence, to monitor regimen changes. It's overall a much better experience for the patient.
Less time is spent writing out patient details and dosaging and the medication itself on the actual label, allowing us to be more confident in what we dispense and providing better healthcare for patients as well.
For now, I can come even at 8 in the morning, but I'll get the medication around before 8:30. So it's actually 2 hours less than the time before.
The last time I've been to the pharmacy, there wasn't even a queue. It was a matter of a few seconds and I've been served.
I was so happy because I didn't wait for so long. I wait for 15 minutes, 30 minutes, I get all my medicine and I go home so quickly.
The impact on the community is massive in terms of just being able to go and collect your medicine on the day that was scheduled. It makes a huge difference to somebody's life. Chilisoft was chosen out of 683 applicants to become a Microsoft Equity Equivalent investment partner, and we're very excited about this. But what it does mean is that we would be able to focus on future versions of ReMed, and we would be able to grow our product. We were chosen specifically for ReMed because Microsoft recognizes its relevance to Africa and its impact on society. We believe that we should provide a good quality solution that will add immediate business benefit, but it should be scalable as well. ReMed offers a very simple solution. It adds immediate benefit from day one, and it's one step closer towards getting an electronic medical record. I don't see the point in waiting when you can actually implement a solution that adds practical value now.